When you take the skull in your hand, you just see the orbits of pyramid-shaped bony cavities, one on each side. The orbit contains eyeball, muscles, extraocular, intraocular, fascias, orbit and bulbula, and nerves, optic, second nerve, oculomotor, third nerve, trochlear, fourth, abducens, sixth, ophthalmic, sixth, ganglion, ciliary ganglion, vessels, ophthalmic artery, ophthalmic veins, gland, lacrimal gland, and orbital fat. You will, when you studying, you please have your skull in front of you or your atlas. Try to, those who have tab or your any gadget, you download Magman's Atlas, Magman's Atlas. It gives a it is a true picture of all human skeleton. Now, this diagram you have to practice because questions come from this. Now, this superior orbital fissure and the optic canal, anterior view, recurrent branch of the ophthalmic artery is not labeled in the main clarity. Now, Levator Palpebrae Superioris, superior rectus, superior oblique, medial rectus and inferior rectus and lateral rectus. These are the muscles of the eyeball. And now, see, this is the fissure and lateral part, lacrimal nerve, frontal nerve, trochlear nerve, superior ophthalmic vein, common ring, tendinous ring, and lateral rectus, internal rectus, medial rectus, superior rectus, and your Levator Palpebrae Superioris, superior rectus. This is the very important, this is the optic canal, this is the optic nerve, this is the ophthalmic artery. A question can be of 5 marks or just label the diagram like your short question that this time you had the cerebral artery. The circle of Willis, you were asked to label and mark what is the thing. Now, this is the components, see the eye movements, laterally, medially, superiorly, inferiorly. So, this has to be supported with the eyeball and the muscles. And you can get a true picture. Now, bony orbit. Now, bony orbit is pyramidal in shape and it has the following boundaries. The apex, walls, medial, lateral, roof and floor. Base or the orbital margin. Apex, it is directed behind and formed by the body of the sphenoid. This sphenoid bone contributes to the apex. It is formed by the center of the bony bridge between optic canal and superior orbital fissure. Now, here the bony orbit, the orbital plate of the frontal bone, greater wing of sphenoid, frontal process of the zygotic bone, and the inferior orbital fissure, and this is the superior orbital fissure, and the supraorbital notch, optic canal, anterior posterior ethmoidal foramina, the orbital plate of the ethmoid, nasal bones, and the lacrimal bone here is the maxilla contributing, infraorbital foramen, and the maxilla. Again, it's a practice figure, walls of bony orbit. Now you can see roof. Roof is formed by the lesser wing of sphenoid and orbital plate of the frontal bone. And this is the supraorbital notch. The superior orbital fissure is this shape. The body of the sphenoid, this is the body of the sphenoid, and anterior and posterior ethmoidal foramina. This is anterior and posterior ethmoidal foramina. And this is the intraorbital canal, inferior orbital fissure. Zygomatic foramen, this is zygomatic foramen. Now, Whitnell's tubercle, the greater wing of sphenoid and frontal process of the zygomatic bone. This is the frontal process of the zygomatic bone, greater wing of sphenoid. This is the lateral wall. And the medial wall is contributed by the body of the sphenoid, lacrimal bone, orbital plate of ethmoid, frontal process of maxilla, the anterior posterior lacrimal crest, lacrimal fossa, this is the lacrimal fossa, and infraorbital foramen. Now, the floor is contributed by orbital surface of the zygomatic bone and orbital surface of the maxilla, orbital process of the palatine bone. Now, this is the thing that all the bones are contributing, not the parietal bone or the occipital bone, but you can see sphenoid, you can see the zygomatic bone and body of the sphenoid, orbital plate of ethmoid bone also contributes, and frontal process of maxilla. Now, this is the flow chart, the bony orbit, whatever was I told you earlier, this is in the flow sheet. Now, medial wall, it is the thinnest wall formation, it is formed by 4 bones. Now, this now this might be asked as a small short note, the medial wall of the orbit, and see the bones contributed by 4 bones, frontal process of maxilla, lacrimal bone, orbital plate of ethmoid, and body of the sphenoid. Features: lacrimal fossa, it lies between the anterior and posterior lacrimal crest, it lodges the lacrimal glands. And anterior lacrimal crest, the frontal process of the maxilla presents the anterior lacrimal crest. Now, lacrimal bone presents the vertical ridge called posterior lacrimal crest. Anterior and posterior ethmoidal foramina lie in the junction of the medial wall and roof of the orbit. They transmit the anterior and posterior ethmoidal nerves and vessels. Posterior ethmoidal foramina, this is the medial of the sagittal section, it's a cut in the sagittal section. We have a sagittal section, আমাদের তো sagittal section আছে তো skull. So we have the sagittal section of the skull. You can view, and also you take, studying these, you take 3 to 1 skull, sagittal section and the whole skull, and you will, things will be clear to you. Now, body of the sphenoid optic canal, superior orbital fissure, this is the superior orbital fissure, foramen rotundum, pterygopalatine fossa. Now, maxillary air sinuses, infraorbital foramen. Now, anterior lacrimal crest, lacrimal fossa, frontal process of maxilla, this is the frontal process of the maxilla, and posterior lacrimal crest, lacrimal bone, this is lacrimal bone, and nasal bones here. When you are studying, you please have a picture of the sagittal section, and you go on drawing yourself and labeling them. Now, lateral wall, it's a strong wall, consists of zygomatic bone in front and orbital surface of greater wing of sphenoid. The orbital surface of greater wing of sphenoid features zygomaticofacial and zygomaticotemporal foramina for the zygomaticofacial and zygomaticotemporal nerves, respectively. Whitnell's tubercle. It is a small bony tubercle located behind the orbital margin, slightly below the frontozygomatic suture. Now, attachments. Now, Whitnell's tubercle can it can come as a small short note, 4 marks. Okay. Then you have to the attachments, the lateral palpebral ligament, check ligament of the lateral rectus muscle, suspensory ligament of eyeball, and Levator Palpebrae Superioris muscle. Now, roof formation is formed by orbital plate of the frontal bone in front and lesser wing of phenoid behind. When you see the transverse section of the skull, when you are studying this, you have to see roof is formed by the orbital plate of the frontal bone and lesser wing of sphenoid. Features: fossa for lacrimal gland is located in the anterolateral part of the roof. The fossa for lacrimal gland is located in the anterolateral part of the roof. Trochlear notch or spine is located in the anteromedial angle of the roof. Attachment: pulley for the superior oblique muscles of the eyeball. Now, a pulley is there. So when the muscle contracts, your eye movements occur. Now, optic canal is situated at the extreme posterior parts of the roof. It transmits optic nerve with meningeal sheath and ophthalmic artery. Formation: it is formed by 3 bones: orbital surface of body of maxilla, zygomatic bone anterolaterally, orbital process of palatine bone posteromedially. Features: infraorbital groove and canal transmits the infraorbital nerve and vessels from the inferior orbital fissure to infraorbital foramen. Impression of origin of inferior oblique line muscle lies just lateral to the opening of the nasolacrimal duct canal. Now, the base, the orbital margins. Now, the base of the orbit is formed by the orbital margin. It is open and quadrangular. Boundaries of the base: supraorbital margin is formed by the frontal bone. It has a supraorbital notch for foramen at the junction of 2 lateral thirds and medial 1/3. It transmits supraorbital nerve and vessels. Now, medial orbital margin is ill-defined. It is formed by the frontal bone above and anterior lacrimal crest of maxilla below. Infraorbital margin is formed by the zygomatic bone laterally and maxilla medially. And on medial side, it continues with a vertical ridge called anterior lacrimal crest. Lateral orbital margin is formed by the zygomatic process of the frontal bone above and frontal process of zygomatic bone below. Relations of the orbit are follow: superior anterior cranial fossa, part of the frontal air sinus, inferior maxillary air sinus, medial ethmoidal and sphenoidal air sinus, laterally temporal fossa in front and middle cranial fossa behind. This relations of the orbit, this is important. Now, walls of the bony orbit is again a repetition. It's a drawing practice figure. That means questions come. Now some. Now some interesting facts. The visual axis passes through the center of anterior and posterior poles of the eyeball. See, this is the medial wall, 2.5 centimeters. This is the eyeball, this is the eyeball. This is the visual optical axis, visual axis. This is the lateral wall, and this, now this angulation is 90 degrees. Now lateral wall, and this is the visual optical axis, and this is the orbital axis. Red is orbital axis, and the visual axis, they are 20 to 25 degrees, and this is 90 degrees. Now, visual axis, it passes through the center of anterior and posterior poles of the eyeball. This is the visual axis, this is center of the good straight, and orbital axis passes through the apex of the orbit, and center of base of the orbit. This is the apex of the orbit goes. And the angle between the visual and orbital axis measures about 20 to 25 degrees. This is the difference. Now, orbital index, maximum orbital height and maximum orbital breadth into 100. You get an orbital index. An orbital is used for forensic medicine, anthropology and surgery. This is important. Now, it can be a short note on this part. Okay? Now, orbital fascia or Periorbita. The orbital fascia, here this is a sagittal section with the eyeball. This is the orbital septum. This is the orbital septum. You can see the eyeball, the optic nerve, this is the orbital fascia. Okay, in green. Now, orbital muscle, orbital fascia, facial sheath of the eyeball, orbital septum. Now, the periosteum of the bony orbit forms the orbital fascia or periorbita. As it is loosely attached to the bones, it can be easily stripped. So, you can take out the orbital fascia, you can pull it out, and bones, it can be easily stripped. It forms a funnel-shaped sheath around the orbital contents. Posteriorly, it is continuous with the dura mater around the optic nerve. At the opening of the orbit, it is continuous with the periosteum of the adjacent bones. Okay. Now, lacrimal fascia is derived from the orbital fascia. It covers the lacrimal fossa. Lacrimal fascia gives attachment to medial palpebral ligament and lacrimal part of the orbicularis oculi. Bulbar fascia, Tenon's capsule. This is the inner layer of the orbital fascia in the orbit that forms facial sheath of the eyeball. Now, what is Tenon's capsule? Can be a question of 2 marks or MCQ. And Tenon's capsule, this is the inner layer of the orbital fascia in the orbit that forms facial sheath of the eyeball. It is thin, loose, membranous sheath around the eyeball. It extends from the optic nerve to the sclerocorneal junction or limbus. Now, what I want to stress is that every time I am telling you that you have to practice with your drawing and figures. It can be a small sketch, and your the sagittal section of the skull, a base of the skull, the transverse section, and also the whole skull. You just place them in the table and try to compare and study. Now, bulbar fascia, Tenon's capsule, this is the inner layer of orbital fascia in the orbit that forms facial sheath of the eyeball. It is thin, loose, membranous around the eyeball. It extends from the optic nerve to the sclero. You see this green, this is sclera, and this is the cornea. The sclerocorneal junction, it ends. This is one point to note. And it is thin, loose, membranous sheath around the eyeball. It extends from the optic nerve to the sclerocorneal junction or limbus. Tenon's capsule is pierced by tendons of extraocular muscles. Tendons of extraocular muscles, the muscles of the eyeball, it is inserted into the Tenon's capsule is pierced by the tendons of extraocular muscles, ciliary vessels and nerves, and optic nerve. You can see. Okay. Now, some interesting facts. The orbital muscle, it is a smooth muscle that bridges the inferior orbital fascia, and it is considered a rudimentary muscle. It is fused with the Periorbita, orbital fascia. It receives sympathetic innervation and its function is not known. Orbital septum, these are extensions of orbital fascia at the upper and lower margins of the orbit. Orbital septum extends into eyelids. Episcleral space, it separates Tenon's capsule from the sclera, fibrous strands connecting sclera and Tenon's capsule. Episcleritis is an inflammation of the episcleral space. Facial sleeve of extraocular muscles are tubular sheaths that derive from Tenon's capsule. So, medial check ligament, it is a strong triangular expansion from the facial sleeve or sheath of the medial rectus muscle to the lacrimal bone. Lateral check ligament is another strong triangular ligament that extends from the sheath of the lateral rectus muscle to the zygomatic bone. Suspensory ligament of the eye or suspensory ligament of Lockwood. It is a hammock-shaped ligament stretching below the eyeball. Charles Barrett Lockwood, a British surgeon. Now, laterally, it is attached to the lateral check ligament and medially to the medial check ligament. It is derived from the fusion and thickness of facial sheath of inferior rectus and inferior oblique muscles. Now, Tenon's capsule, and it can be a even 10 marks question. You please focus in this area and also the muscles of the eyeball and it's now see suspensory ligament of Lockwood. The suspensory ligament of Lockwood. Now lateral check ligament, medial check ligament. Here the muscles, medial rectus, lateral rectus, inferior rectus, inferior oblique. Now I use inferior oblique. Now this is the picture, and also so you can see the importance. Now again the same thing, but in the practice figure, lateral check ligament, medial check ligament. This Windall's tubercle is here, posterior lacrimal crest is here, and medial rectus, inferior rectus, inferior oblique. This is the suspensory ligament of Lockwood. Extraocular muscles. The question is, describe the origin, insertion, nerve supply and actions of extraocular muscles. So you can see it is a very important to note because these are the common questions that may come now আসবে head neck থেকে যদি প্রশ্ন আসে, especially eye the orbit. This not only this, whatever the previous three slides, whatever I showed you, you have to take care of. Now, extraocular muscles of the eyeball are classified into two groups, voluntary and involuntary. Voluntary and involuntary. These are 7 skeletal muscles. These are 7 skeletal muscles. They are as follows. 4 recti muscles. 4 recti muscles are superior rectus, inferior rectus, medial rectus and lateral rectus. So 4 recti muscles, you just remember. Superior, inferior, medial, lateral. Okay. Now 2 oblique muscles. Superior oblique, inferior oblique. 1 Levator Palpebrae Superioris, muscle of the upper eyelid. And involuntary muscles, these are 3 involuntary smooth muscles, superior tarsal of Miller's muscle, inferior tarsal and orbitalis. Here, extraocular muscles, see the pulley here, superior oblique. When insertion ache, accordingly the eye movement. Lateral rectus, laterally you will pull, medially medial rectus. Now, in that way, the eye movement. Now, some interesting facts. Superior tarsal muscle is deeper part of Levator Palpebrae Superioris muscle that is inserted in the upper border of superior tarsal plate. Innervated sympathetic fibers from T1 segment of the spinal cord. Action elevation of the upper eyelid. Now, de-innervation of superior tarsal muscle in Horner syndrome, T1 fiber injury, results in ptosis, drooping of the eyelid. Now, inferior tarsal muscle is a smooth muscle that extends from the facial sheath of the inferior rectus and inferior oblique to the lower margin of the inferior tarsus. It depresses the lower eyelid. Orbitalis is a smooth muscle that brings the inferior orbital fascia. Action is not known. Now, recti muscles. Now, Levator Palpebrae Superioris, lesser wing of sphenoid, the superior oblique, here, body of the sphenoid, and this is the optic canal. This is recti muscles. Tendinous ring of Zinn. Tendinous ring of Zinn. It can be a small MCQ question. Inferior oblique. Orbital surface of the maxilla. Now, all the recti muscles arise from the common annular tendon or tendinous ring of Zinn. This ring is attached to the middle part of the superior orbital fascia. See the middle part of the superior orbital fascia. And lateral rectus has two heads. One arises from tendinous ring, another from the orbital surface of the greater wing of sphenoid. Lateral to the tendinous ring. Insertion. See how the muscles are. The lateral rectus, superior rectus, medial rectus, inferior oblique. Now, here's the superior oblique with a pulley here. All the recti muscles are inserted into the sclera, little posterior to the limbus, sclerocorneal junction, in front of the equator of the eyeball. The distance from the limbus and the insertion of the recti muscles. Now, this is a reference from Gray's Anatomy. Medial rectus, 5.5 millimeter, inferior rectus, lateral. These you did not remember. The recti muscle, this is the cornea, this is the iris. Now, this is the medial rectus. These are the distances. Now, there are two oblique muscles, superior oblique and inferior oblique. The superior oblique muscle is here, spiral of tilus, medial rectus, limbus, inferior rectus, inferior oblique. This is the inferior oblique muscle. And this is the lateral rectus. Now, it originates from the body of the sphenoid superior-medial to the optic canal. Direction of the fibers, the muscles run forward to form a tendon that passes through the fibrocartilaginous pulley attached to the trochlear fossa of the frontal bone here. And further, the tendon passes through laterally downwards and backwards. Insertion is inserted into the sclera behind the equator of the eyeball. Here, behind the equator of the eyeball, and tendon passes laterally down and backwards. Insertion, it is inserted in the sclera behind the equator of the eyeball between the superior and lateral recti, the superior and the lateral recti of the eyeball, and lateral recti in this posterior superior quadrant of the eyeball. Inferior oblique originates from the orbital surface of the maxilla, lateral to the lacrimal groove. Direction fibers, the fibers passes laterally upwards and backwards below the inferior rectus and further deep to the lateral rectus muscle. Insertion, it inserts into the sclera behind the equator of the posterior inferior quadrant of the eyeball, below the posterior insertion of the superior oblique. Now, it is all in the, muscles are attached on the sclera, and Levator Palpebrae Superioris is a muscle of the upper eyelid. It's thin triangular muscle, originates from the lesser wing of sphenoid above and the front of the optic nerve. Now, you have to read the fibers, inferior lamina are smooth muscle fibers that superior tarsal muscle. This is inserted in the upper margin of the superior tarsus. Innervation, all voluntary extraocular muscles are supplied by oculomotor nerve. Now, this is you have to remember the innervation of the voluntary, all the voluntary muscles are supplied by the oculomotor nerve except the superior oblique, which is supplied by the trochlear nerve, lateral rectus, which is supplied by the abducent nerves, and involuntary muscles of the eye are supplied by the post-ganglionic sympathetic fibers from superior cervical ganglion. The nerve supply, innervation, you have to know. Now, this is the nerve supply of the extraocular muscles. Now, you can see Levator Palpebrae Superioris, superior rectus, upper division of the oculomotor nerve. This is the upper division. This is the lower division of the oculomotor nerve. This is the optic nerve. And lateral rectus, abducent nerve is supplying. The ciliary ganglion is here. The inferior oblique, inferior rectus, in between that, the ciliary ganglion is there. Note this, actions, write a short note on action of eyeball, movement of the eyeball. Please note that question. You just write that this can be a question and write a short note on action of the eyeball. Now, movements of the eyeball. Now, you draw a figure like this. That is the elevation. The muscle involved is inferior oblique and superior rectus, and lateral rectus here, abduction, medial lateral rectus, superior oblique, inferior rectus, depression, superior oblique and inferior rectus, depression. Now, and the medial rectus, adduction. Okay. Now, you can see the eyeball moves along the following three axes perform the follows. Around the transverse axis, elevation or upward movement, rotation. Now, B, depression or downward rotation. Second is around the vertical axis. Adduction, abduction, medial rotation and lateral rotation. Around anterior posterior axis, intorsion, medial rotation of cornea from its 12 o'clock position, and extorsion, lateral rotation of cornea from 12 o'clock position. The actions of individual muscles are listed. Now, this is a chart, the muscle and the action. Superior rectus, elevation, adduction, intorsion. Inferior rectus, depression, adduction, extorsion. Superior oblique, depression, abduction, intorsion. Inferior oblique, elevation, abduction, extortion. Medial rectus, adduction, lateral rectus, abduction. Levator Palpebrae Superioris, elevation of the upper eyelid to open the eye. Now, this is the right eye, the superior rectus, elevation, adduction and intorsion. This is what it looks like. So, you please see and you can take and draw this picture. Now, inferior rectus, depression, adduction and extortion. Now, medial rectus, adduction, lateral rectus, abduction, superior oblique, depression, abduction and intorsion. Inferior oblique, elevation, abduction, extorsion. Action of individual muscles of the eyeball, right eyeball. This is the right eyeball. You can take you see paralysis of the right lateral rectus muscle. Now, damaged right abducent nerve, paralysis of the right lateral rectus, and esotropia, internal strabismus, and normal eye. This is the normal eye. Now, strabismus or squint Unilateral paralysis of individual extraocular muscles produces strabismus or squint. It causes deviation of eyeball to the opposite side due to unopposed action of the non-paralyzed muscle. Diplopia, double vision, as the light from the object will not be focused on the identical areas of both the retina. Paralysis of the lateral rectus due to damaged abducens nerve results in esotopia or medial squint, internal strabismus. Diplopia appears on the looking onto the paralyzed side. Paralysis of medial rectus due to damage of oculomotor nerve results in exotopia. Diplopia appears on looking to the unaffected side. Previous concept, terms medial squint or internal strabismus and lateral squint, external strabismus are currently not in use. So nystagmus is an involuntary, rhythmical, oscillatory movement of the eye. It may be produced by cerebellar or vestibular disorder. When you read the brain, then your cerebellar and vestibular disorder, nystagmus, both the eyeballs will move like this. The oscillatory. And normal eye, extropia of the left eye, this extropia, normal eye. এই চ্যাপ্টারটা প্রচুর সম্ভাবনা আছে কোয়েশ্চেনস আসার, মানে এবং তুমি যদি খুব ভালো ভাইবা বলো তাহলে তোমাকে ডেফিনেটলি জিজ্ঞেস করবে। আর তুমি ডায়াগ্রামেটিক রিপ্রেজেন্টেশন দিয়ে লেবেল করে পড়বে। একটা গোল আঁকবে, একটা অ্যাক্সেস আঁকবে, মাসেলগুলো superior, lateral, medial, inferior. You have to build up a concept.